discussion today with lawmakers that are concerned and working on this issue, and to hear from the diabetes advocates and people that know all too well the true cost of insulin in this state, and to work together to move forward and take action. To begin with, I just want to talk a little bit about the agenda. We want folks around the table to just do brief introductions so folks know who's here. Then we're planning on doing a bit of a status update on the Alec Smith Emergency Insulin Act, where we've been and the progress we've made. Then have a discussion where we're hearing from our diabetes advocates who can share their real-world experiences and how that connects with the legislation we're trying to pass. And then we are going to have some public testimony, an opportunity for those in the public who do want to share their story or a couple minutes as well near the end of the meeting. And if folks are interested in testifying, Chris McCall with the House has a sign-in sheet back there. And we have an hour and a half of time, but we're going to do our best absolutely to make time for folks that came here to share their story as well. So with that, I think we can just go around the room and just tell folks who are here. I'm Representative Michael Howard. I represent Richfield and Bloomington in the Minnesota House.
I'm Laura Taken-Holtze. I'm a committee administrator with the House.
Good morning. I am Representative Lori Halverson from Egan, and I am also a person with type 1 diabetes.
Good morning. My name is Representative Kristen Bonner, and I represent Maple Grove and Osseo.
Good morning. John Purcell, State Representative, District 5A.
I'm Representative Jenny Cleaborn. I represent District 44A, Plymouth, Minnesota.
Good morning. My name is Ryan Winkler. I represent District 46A, Golden Valley, St. Louis Park, Plymouth, and Medicine Lake. I'm also the House Majority Leader, but more importantly today, I'm the parent of a type 1 diabetic child who is 12 and has had diabetes since he was 18 months old.
My name is Quinn Maestro. I live in Baxter, Minnesota. I'm a diabetes advocate, and I've had type 1 diabetes for 20 years, and my younger brother has had type 1 for 22 years.
I'm Michelle Camela from Fergus Falls, Minnesota. I'm type 1 diabetic also, and here to discuss the struggles that I go through every day.
Representative Robert Bierman, 57A, Apple Valley in Lakeville, and a couple family members with diabetes as well.
I'm Melissa Halverson-Wicklund. I'm in the State Senate. I represent Bloomington and Richfield in the State Senate, and I chief authored the Alec Smith Emergency Insulin Act in 2019.
I'm Kelly Morrison, State Representative from District 33B, which is 9 communities in the South Lake Minnetonka area. I'm also a practicing physician.
My name is Kim Monson. I live in Lakeville, and my oldest daughter, Kinsley, was diagnosed with type 1 diabetes at the age of 4.
My name is Nicole Smith Holt, and I live in Richfield, Minnesota, and I am the mother of the late Alec Smith, and I am the T1 International Charity Ambassador, and I also co-chair the Minnesota Task Force for Lowering Prescription Drugs.
I'm Lea Greenside. I'm from St. Paul, Minnesota, and I'm the mother of a child with type 1 diabetes.
Yeah, thanks. I'm Senator Jim Abler from Anoka. I'm honored to be invited by Representative Howard and happy to be part of the solution. Senator Jensen would have come, but he's at his clinic today, so thank you.
I'm Blake Wilcox, and I'm the legislative assistant to Representative Howard.
And I see we have a few more reps and senators here. If you want to just introduce yourself.
Eric Kraft from Scott County.
Representative Sandy Mason, 51A, Burnsville and Egan.
All right, thank you. I really look forward to this discussion. And next, I just want to talk a little bit about kind of where we've been and where we're going, and hopefully where we end up with the Alec Smith Emergency Insulin Act. And the work on this bill started more than a year ago after the death of Alec Smith, who died rationing his insulin, and the recognition by many that this should never happen. This should never happen in Minnesota. This should never happen in this country. And the reality is, studies show that 1 in 4 people with diabetes are rationing their insulin, And the big reason is the cost has soared. A vial of insulin that used to cost $30 now costs $300. The price has tripled in the last 10 years. And it's incumbent, I think, on legislators, anyone responsible in our healthcare system to step up to solve this crisis so that it doesn't happen again. The Alec Smith Emergency Insulin Act was introduced this session in February, and by myself in the House and Senator Wickland in the Senate. As the bill went through the process, we did pass it in the House. A version of it did pass in the Senate. Ultimately, it did not become law. And I don't think we're here today to really go through what happened at the end of session. A more productive conversation is how we ultimately take action and pass this bill. But just a little walkthrough of the bill to kind of center us. The premise of the Alec Smith Emergency Insulin Act is a simple one, which is never again. Never again should someone lose their life because they cannot afford the insulin they need to survive. And so the focus on this bill is narrowly targeting the band of Minnesotans that are potentially in a situation like Alec, who is working hard but not earning enough money to afford the crushing cost of insulin. This bill would set up an opportunity for those Minnesotans to receive a short-term supply of insulin at an affordable price. And again, targeting those most in need. The bill would create an infrastructure for a program that's relatively barrier-free for patients, because we want to make sure that we have something that will work for those in need, and an effective structure to make sure this program is administered effectively. In the House, this bill would be funded through an insulin manufacturer registration fee, which would ask basically the big three insulin manufacturers to have a stake in solving a crisis that they've profited from richly. Where I want to go next is to talk about the work of a bipartisan, bicameral group of representatives and senators that have met over the course of the summer. This was a group called together by Senator Matt Little, and over the course of the summer, this group met on a number of occasions with the opportunity to sort of set aside the partisanship and hopefully work together to find a solution. And I'm really grateful for all those representatives and senators that participated in that group. Out of that group, those discussions, I think we've improved the bill. And I specifically want to recognize Senator Abler and Senator Jensen for some of their contributions. Just to highlight a few of the changes or modifications from the bill that was taken up in the House. We're looking at a delivery model that's a little different at the pharmacy level that I think makes it easier for patients to receive the insulin that they need. And we're also looking at connecting patients with better access to long-term management after they receive their emergency supply. And we've also looked at strengthening some of the eligibility so we make sure that nobody falls through the cracks. This group, while we've driven towards broad consensus on the parameters of the program, there's less consensus about how to pay for it, and that's something that I think we can discuss today as well. And at this point, before we kind of open it up to discussion, I want to give an opportunity for some comments for the representatives and senators that were part of that working group, just to share their comments as well. And first, I'd like to invite Senator Abler to make some comments.
Well, thank you very much, and thanks, Representative, for inviting me to be part of this. This is a really important matter, and it just seems it should just get done. We fixed MNLARS, we were the only divided legislature in the country. Actually, we got it squared away, and Representative Winkler was part of that. And this is much easier. I just wanted to offer a few thoughts. In my discussions that you haven't been a part of, and just to give you my view of the big picture, and actually we'll be brief. There have been 4 proposals that have been out there. There was this one, the Senate file, or House File 45, and whatever the Senate file was. And then there was the floor amendment that came at 3 o'clock in the morning from the DFL generally, and those had pharma paying for everything. And then there was the Benson Amendment, which was offered, again, as a floor amendment, kind of also sort of hastily. And then the Hamilton Amendment, which was offered also as a floor amendment. And so those had state paying everything. So there's kind of 4 offers on the table. I was talking to former, I guess, Commissioner Laurie about these, and he says, you know, none of those actually would work. There's missing parts in all of those. And so I was really happy that the work group could get together, and we fleshed out a lot of those matters. Who's eligible? Who's going to dispense it? What network? And we are hamstrung on the money part, but we worked out a lot of details. And so I think this is extremely healthy and really productive. My frustration as kind of a middle manager is it's time to figure out how to pay for this. And if I were the king, and you'll know very much that I'm not, farmers should pay every penny. They deserve it. They have been immoral in their raising the rates. They have plenty of money, and they should just write a check and be done with this. However, in the world of what I see, they would not simply write a check. They would litigate and tie this thing up forever. And I think the problem, it would never stand up as a project. And so I think we could pass it unanimously, and still they're going to argue about that and litigate and put injunctions and drag this thing out for a good long time, because I think that they are just the wrong version of capitalism in my mind. And so they just want to avoid the exposure nationwide. And so that's why I'm just encouraging us. Glenn Taylor wrote an editorial that I thought was like wow. What if we shared the cost? And so my latest, if you followed me, I've been having different iterations of comments, and we are moved a long way. But I think at this point, we're to the point now that if the 3 leaders could sit together, and I've got Majority Leader Winkler is here to kind of pass that message on, the 3 leaders could sit down, and then Pharma would actually go there and say, by the way, kids, we're going to do this. Could we do a $6 million program? Could the state pay 3, you pay 3? And set the eligibility. DHS is totally capable of handling this, given all their challenges. This is not a tough one. And so we could move forward. And so my calls these days are going to be to the leaders. And I'm actually concerned that if they don't, the next step is not going to be on us. It's not going to be on anybody at this table. It's going to be on them. And there should be no more. The funeral for Jesse was 2 miles from my house. And I just went there quietly and said goodbye. And it was horrible. And he had a bow tie and a nice vest, and he was beautiful. And people die, tragically, but nobody should have to die from this. And so that's my commitment to you all, and I'm so grateful to Mike for partnering. And so that's going to be my speech going forward, and whatever Scott and I and Eric Pratt is here too, and kudos to him. And a lot of us care about this, and it's time to move to resolutions. It's time to, I think we should have hearings on our side as well. I'm glad for this here, and we need to get this done. Thank you.
Thank you, Senator. Representative Halverson.
Thank you, Representative Howard. And I want to begin by thanking both Representative Howard and Senator Halverson Wickland for taking leadership on this early in the legislative session and making sure that the voices of advocates are heard. Your work has been really important to creating a product that really reflects the values of the people of Minnesota. And that's why I'm very glad to have advocates sitting with us at the table today. We don't get to build public policy behind closed doors. We build it out in public with the people that it's going to impact. And so the fact that you're sitting here at the table means a lot to me. As I mentioned, this is personal down to my core. And I've often thought it's been interesting watching this process take place and the many hearings that this bill had at the Capitol, including in the Commerce Committee that I chair, in the Health Committees. People are very surprised at the challenges that we have managing diabetes. And I'm going to tell you why. I'll throw down and let you know why you're surprised that diabetes is hard. It's because that everybody who is here managing diabetes and taking care of their children with diabetes work on it 24/7, 7 days a week. We are constantly thinking about our numbers. We are constantly managing the illness. And I will tell you that one of the reasons that people with diabetes, I believe, don't tell you how hard it is because people with diabetes still face discrimination, right? Workplace discrimination. Can you do your job if you have this disease? Because people don't understand it. There are restrictions regarding driving, regarding flying planes, and yet people with diabetes are leading at the highest levels in our country. We have a person with type 1 diabetes on the Supreme Court. The Prime Minister of the United Kingdom had type 1 diabetes. We have diabetes, people with type 1 who are race car drivers, professional athletes. They run marathons, and their moms and dads and brothers and sisters and kids. So I appreciate people being willing to tell their story, because the story of Alec Smith, I think, for somebody with diabetes is not a story that surprises us, because we know how intense it is to manage diabetes on a day-to-day basis. The fact that the Smith-Holt family lost this precious son is not reflective of the family and how they cared for their child, and it's not reflective of Alec Smith. It's reflective of one thing: the fact that we have monetized insulin, which was given to the world almost free by its inventors in order to do good. And in order to save lives and make sure that people could live long, healthy, happy lives. And it's been monetized to a point where people can't manage to get a hold of it. If a vial breaks, if you're waiting for your paycheck and you're running low on insulin, you're doing everything you can to manage to make it to that next step. And these are not anomalies. That's the other thing that we really have to recognize. These are not just a handful of stories. And hats off to the advocates who sat down with Governor Walz this summer, who said never again is going to happen, because it did in Minnesota. So woe to all of us who didn't get it done last session. Honestly, it's really a heartbreak for me. We had months and opportunities to take care of it, and we didn't. So I could not be more grateful that we are here today. I could not be more grateful to hear voices of the Senate calling for hearings. This bill did pass the House. We certainly have had time to work on it, but I'm thrilled that it's coming out again in the public, and that we get to hear from all of you. One question that we have yet to answer, and I think that Senator Abler was asking it and perhaps answering it as well, but I really think that we need to be honest about where these price hikes are coming from. I have yet to hear a reason why this life-giving drug has increased the way it has without changing in formula at all since 1996. Having not heard that reason, having not heard responsibility from the insulin manufacturers, having not seen insulin manufacturers being willing to come to the table has been a frustration for me. And I will tell you, others are coming to the table. Other folks in the industry, in the healthcare industry, are coming to the table. And we have yet to see that happen from the people who are hiking the prices. And it's time for everybody to come to the table. And I guess I'll put my line in the sand and say, if you don't come to the table, woe to you. We will drag you there kicking and screaming. We are not going to let our constituents and our family members die because their drugs are too expensive. Those days are coming to an end in Minnesota. So I encourage everybody to come to the table. and sit across the people who they're, whose drugs they depend on to live, and help us. Help us. Never again has already happened, Minnesota. It's time for us to pass the Alec Smith Emergency Insulin Act. Thank you.
Thank you. Representative Morrison?
Thank you, Representative Howard. Thanks to everyone for being here. Thank you especially to advocates and for all you've done to bring this issue to the forefront. I want to thank Representative Howard and Senator Wickland for authoring the Alec Smith bill. It's incredibly important. I'm heartened to see that there's media here bringing attention to this because I share Senator Abler's urgency that we need to get this done. I think there is real impatience in the state of Minnesota. People are done. They want us to get this done. So I thank the media for being here as well. We've known how to manage this condition for a long time. This is not revolutionary. This is not new. There's no reason for insulin to be as expensive as it is, and there's no reason for another Minnesotan to die because they cannot afford to access their insulin. So I just want to say, as a physician, I am not a diabetic myself. I am not a person who struggles with managing diabetes, but I take care of a lot of people who do. So I know firsthand how challenging it is to take care of it, to improve it, to manage it. Let's make it easier, not harder for our people. Thanks.
Thank you. Senator Wickland?
Thank you. Thank you, Representative Howard, for organizing the meeting today, and I really appreciate the opportunity to be here and be a part of it as well. I have been grateful that we've been able to continue to work on this bill or this program since the end of session. I'm grateful for the discussions that we've been able to have. They've been bipartisan and meaningful, and we've been able to focus on, specifics about, how to make this bill work better. And I think that what we've come up with is a better bill than what we ended the session with. And now I'm hopeful that we can move and go, as Senator Abler said, go from here and see some action take place. I really appreciate that I've been able to learn from the advocates, especially Nicole, and thank her so much for keeping us grounded in, why this is so important that we continue to work on it. I feel like I've learned a huge amount over this session about diabetes and the industry, and the more that I learned, the more I worked on this bill, it just made me more sure that we need to be taking action in Minnesota about this particular issue, emergency access, and we need to be working, on other matters on why drug costs are so unaffordable and insulin costs are so unaffordable for people in Minnesota. So, I look forward to having this discussion today to understand better, reactions to the proposal and how we might improve on it and hear from the advocates on that. But bottom line for me is that we do work together to make sure that the manufacturers are involved. If they are not willing to come to the table and discuss with us how to make this happen, I think that we need to continue to focus on retrieving some of the fees and costs from them to make sure that we can implement the program in Minnesota. And it's critical that we listen to the voices at the table today, and I appreciate your willingness to hold the conversation so that we can do that. So thank you.
Thank you, Senator. And that's actually a really good segue. We're going to have an opportunity for all the legislators. And thanks, everyone who came here today. We invited members of the bipartisan working group as well as every member in the House. And so I appreciate folks that came out today. But we'll have an opportunity for that dialogue with everybody. But next, I'd like to open this up for our advocates to share some of their experiences, their reactions to the legislation, and to hear from them, because I really think we would not be in the place we are without for the strength encourage of Minnesotans to share their experiences. And it's together in partnership that ultimately is going to help us move forward and pass this bill. So I guess first I'll turn it to Nicole.
Good morning. So my name is Nicole, and I am the mother of the late Alec Smith. Most of you have previously heard the story of Alec's death, so I'm not going to share that today. Instead, I want to tell you that just 2 nights before Alec's body was discovered, he was out to dinner with his girlfriend. He wasn't feeling well, but he was alive. 48 hours later, his body was discovered, and the medical examiner believed that he had been gone at that point for 18 to 24 hours before he was found, which means just 24 hours after his dinner with his girlfriend, he died. That fast, he was gone. Gone forever. I often hear people tell me and others that we should call the pharma companies and ask them about their patient assistance programs. And I can tell you that they all have these programs. But it takes a lot of time, energy, and it's a pain in the butt to apply for these programs. They often require a ton of paperwork, faxing back and forth, multiple phone calls, visits to the doctors to have them complete forms, more phone calls, and periods of time of waiting, more hurdles to turn around and do more waiting. Sometimes 4 to 6 weeks to get approved for these programs. And as you heard, Alec died in 24 hours. Type 1s in an emergency situation do not have days or weeks, or they have hours, precious hours, before pain sets in and their systems and their bodies shut down. They don't have time to go to the ER. They don't have time to call a friend. They're dying rapidly. I applied to all of these programs on Alec's behalf. Every single assistance programs, pharmacy programs, I applied for them all. And unfortunately, he was denied. Alec was not rich. He was a hardworking single young man making $40,000 a year, and he was denied life because he made too much money. In fact, more than 40% of those who apply to these charity programs that these pharma programs offer are denied. They're denied for making $2 more per month than their program allows. I've heard of people being denied who are on Social Security benefits. It's ridiculous. It's absolutely ridiculous. So these people are basically denied life. There's a lot at stake. Precious human lives are at stake. We as a community have an obligation to save the lives of those who need help. As a member of the Minnesota Insulin for All chapter, we're working diligently to help those who reach out to us in need. We should not be bearing the responsibility of these lives. We do all of that so that we can provide resources to those at risk of dying because they cannot access affordable insulin. It's time that our elected officials work as hard as we do to prevent these deaths. I'm pleased that the insurance companies are stepping forward to try to reduce the financial burden for type 1s. Currently, 2 companies have recently capped their insulin prices to begin in January of 2020. The price that pharma charges has not changed for the better. In fact, it's actually risen. We do not know that in the future how this will affect our premiums, but for now, it's a step that helps those that are fortunate enough to have insurance. But we need to worry about those that are uninsured. Those are the most vulnerable, the most at risk, and who would benefit the most from the Alec Smith Emergency Insulin Act. We need this in place to prevent deaths like Alec and Jesse, 2 Minnesota young men who are greatly missed. I encourage you all in the Minnesota Legislature to work together, to put aside the egos, the lies told by pharma and their lobbyists, and work together to become the first state in the nation to create and pass an amazing life-saving bill called the Alec Smith Emergency Insulin Act.
Thank you. Just, who would like to go next? Quinn? Yeah.
I can go in the order if you'd like.
Thank you, sure.
So my name is Quinn Maestro. I'm going to just piggyback off of what Nicole had said and just share a story, because I think we've heard a lot in this process of elected officials saying what I think a lot of us think of as lobbyist points about these patient assistance programs. But what we would like the elected officials to know from people who actually have diabetes, we actually know that these patient assistance programs rarely work. We know that lobbyists, when they meet with you from these 3 big pharma companies, they tell you that they work brilliantly, right? That all of us, we qualify for them, they work so great, we just fill out the CZ form and then we get free insulin, right? It's discounted insulin, we use a coupon, and it works great. Well, let me tell you, it doesn't work for a majority of us. If it was, 1 in 4 of us would not be rationing our insulin because we couldn't afford it. If these coupon programs, these patient assistance programs worked, people would not be dying in this country from insulin rationing, okay? It's not because we're not educated, it's not because we're misinformed. None of us want to be dying or rationing our insulin. Can I make that any clearer, okay? So there's a story of a family that came with us recently on one of our caravans to Canada. They used one insulin kind of patient assistance coupon from one of the insulin manufacturers back in 2016 to get $50 off their insulin when they went into the pharmacy, right? They thought, great, they'll get $50 off, they'll save a little bit of money. So they used it on their 18-year-old son when they went to the pharmacy to get their insulin. They used this $50 coupon, thought, great. The next time they went to get their insulin, their son went to pick it up, it was $1,600 to pick it up for the month. The son called home and said, well, this can't be right. The mom called in to the insurance provider and said, what's wrong? There must be something wrong. Their insurance provider no longer recognized that the son needed insulin because that insulin coupon voided it with the insurance. And so ever since 2016, this family has had to pay cash out of pocket for this type 1's insulin. So this family who came with us to Canada to get a 6-month supply of insulin to keep this kid alive paid nearly $12,000. That's what it would have cost in the United States to keep their son alive. That's what they've been having to pay for him. They've had their electricity turned off. They've had to sometimes go without food on the table. It has been terrible for this family. So I just had to share that story because it is another story of why these patient assistance programs do not work, and they can actually work against you. And let me tell you, these 3 pharma companies do not tell you that when you're gonna use a coupon, okay? They don't tell you that that can void and set you up terribly for years to come. And they have tried appeals, they have been on the phone, and nothing has changed. So I know I get passionate about it, but this family now is in a terrible situation and nothing can change because it's an employer plan. So, and she's a high school choir teacher and doing her very best to keep her son alive. And now her son has actually rationed because he feels like he's such a burden on that family, which I think is absolutely crushing. Anyways, so I'm gonna say what I was planning to say, which is, you know, I think it's hard to believe that 100 years ago, getting diagnosed with type 1 diabetes and some forms of type 2 diabetes in America was a death sentence, okay? 99 years ago, when 4 inventors, and the 4 inventors are the names on my t-shirt, when they invented insulin 99 years ago is when type 1 and some forms of type 2 diabetes was no longer a death sentence, when they discovered insulin. Now, when these 4 Canadians discovered insulin, I think a lot of us know this story, but they decided they could have been millionaires, okay? Their families for generations could have been millionaires. Instead, these 4 didn't even want their names on the patent because they didn't want to become famous off of it. They also sold the patent for $1 because they believed that it belonged to the world and that it would save millions of lives because it did. Now, to me, the real tragedy, which there's a lot of tragedies in this story, is now you fast forward 99 years, we're in 2019 in the United States of America, one of the wealthiest, most developed countries in the world, a country where we want to brag about our greatness. And we have people dying because of a diabetes diagnosis in this country in 2019. We have rewound the clocks to 99 years ago, prior to insulin being discovered, because the pharmaceutical companies and the pharmacy benefit managers and health insurance companies have price gouged the price of this 1,200% in the last 20 years. And there have been no laws that have been created to keep them in check. Now, this vial of insulin, Novolog, cost me $340 if I get it filled, retail price. When I cross the Canadian border, the exact same vial, look at it, because if you blink, they look the exact same, cost me $26. It's the exact same vial, okay? But I just crossed the Canadian border. The Canadian government has put in things in place to protect the prices of a life-saving medication. That's the only difference. It's the same insulin. We have a huge problem in America, and people are going to continue to die. We can't continue to turn back the clock because more people will continue to die. Alec, Jesse, this is a tragedy, and it can be something that can be fixed, and we've seen governments around the world in developed countries like ours fix this. And so, like Nicole said, our group, you know, we are passionate volunteers. We have done our best to try to keep people alive by, trust me, we have done things, maybe some things we should do, some things we shouldn't do, but we're trying to keep people alive in our state. But the people that we're looking to are the elected officials around this table. And I'll also say the elected officials who chose not to show up today. We are begging them to call a special session, stop the bickering, and to say, let's just get this done. This isn't a red or a blue issue, it's a life or a death issue. And it can't wait till next February to start being discussed. We gotta get this past the finish line and completed. And so I'm grateful, Senator Abler, you know, that you're here and that, you know, that you want to get this done and that you see that, as well as Senator Jensen, because I don't think this is a political stripe issue, right? And so, and that's what our group thinks as well. And so I'm hoping that that's what's going to happen, that we can get this finished so that not one more innocent life is going to pass in the state of Minnesota, just like Representative Howard said. So thank you all for the work that you've put in, and let's hope we can get this passed this year.
Thank you. Lea?
That's a hard act to follow. My name is Lea Greenside. I'm a small business owner and live in St. Paul with my daughter, who is 13 and who has type 1 diabetes. I've become a vocal advocate for insulin affordability over the last year. I very naively believed that because there was so much public support and bipartisan support for the Alec Smith Emergency Insulin Act that it would easily pass. And I have to say that I am really disappointed in what I saw happen at the end of the session and the politics that intervened. This seems like something that should be very simple and so needed. And I'm heartbroken that since the end of the session, another young Minnesotan has passed away because of insulin rationing. This should not have happened. I'm feeling a little hopeful that things are moving in the right direction. Just yesterday, my insurance company, UCare, was the second in the state to announce that they will be capping monthly insulin costs at $25. And I have to say, I actually cried when I heard that, because the sense of relief that that gives me is something that I think it's a little hard to appreciate. Knowing that we will be able to afford insulin for my daughter starting in January is like a huge weight off. That said, there are many people who will still fall through the cracks, and that's why this bill is so important to pass and to pass now. I've told my stories about problems I've had accessing and affording insulin. My daughter and I have been on the front page of the Washington Post talking about how we've bought insulin in 6 countries for 1/10 to 1/18 the cost of what we've paid here in St. Paul. I've also shared before that we've had many struggles with accessing insulin in January. It took me 15 phone calls over an 11-day period just to refill my daughter's insulin. If you think about that, 11 days, as Nicole stressed, someone without insulin will die within a few days. So we were fortunate, and I'll say more than fortunate, we know, and so we do things like try to stockpile insulin when we can so that we make sure that we're never without. So I'm not going to tell more of my own stories. I wanted to share with you just a few posts that I found in a local Facebook group for people with type 1 diabetes. These types of posts come up all the time. And listen for what I hear as shame and fear and anxiety and desperation from these people who, again, are looking to Facebook, to strangers in a Facebook group for their life-saving medication. So my first example, the person wrote, "I hate posting this, but does anyone recommend any programs where I could get cheaper insulin? Or what is the process to get it from Canada or online? I'm employed full-time, and unfortunately, most programs see my wage as, quote, making enough to afford my insulin. However, my health insurance costs plus copay costs are ridiculous, and I can't afford them. Basically, I'm in desperate need of Basaglar pens. Thanks for reading." So my second example here. Looking for some advice. I just started a new job, and my insurance doesn't kick in until October 1st. This was posted sometime in the last couple weeks. I'm concerned about being short on Tresiba. I knew I'd have a short lack in insurance coverage, but I wasn't planning on 2 months. I have enough Novolog stocked up to get through, but I'm concerned about Tresiba. This is the long-acting insulin that the person needs. Anyone have any advice where I can find a few flex pens without spending a small fortune? And then my final example. Hello, I'm wondering if anyone is in the Coon Rapids area that may have an extra Basaglar pen they're able to part with. We have a day and a half left on our pen at the moment. My insurance won't cover another one until 2 weeks from now, and I cannot afford it out of pocket. I can pick it up tomorrow. So in Canada, each of these people could just walk into a pharmacy and pay $25 and get whatever they needed right then, 5 minutes, they'd have what they needed. But instead here we have this situation in which people are desperately pleading on Facebook from strangers to give them what they need because they can't navigate the system and get their insulin. So we need to change this. We need to provide them with a program like this Alec Smith Emergency Insulin Act that will assure Minnesotans that when they are in these situations, they don't have to beg from strangers, they don't have to buy insulin from the black market, they don't need to try to ration it dangerously and die. They need to know that they can go to a pharmacy and get the insulin that they need. I feel like this is it's humane. It provides dignity for those of us who are reliant on this drug. And we need to stop the partisan bickering and get this passed. Thank you.
Thank you.
Hi, good morning. My name is Kim Monson, and I live in Lakeville along with my husband and my 2 daughters. My oldest daughter, Kinsley, was diagnosed with type 1 diabetes when she was 4 years old, and now she is 8. Because children are not routinely diagnosed or screened for type 1 diabetes, she was diagnosed in the hospital in St. Paul at the Children's Hospital. We missed all the early signs and symptoms because, frankly, we just didn't know what they were. So we spent a lot of time there in those early days, and any free moment I had, I would go onto websites to try to learn more about this disease. And some of those early things I learned included nerve damage from this disease can cause foot and leg amputations. Kidney disease can lead to dialysis and ultimately kidney transplants. Diabetic retinopathy is the leading cause of adult blindness in the world. And one of the most disturbing things for me personally was the average person with type 1 lives 10 to 15 years less than a person without. These are just some of the many complications that anyone touched by this disease worries about often, and especially a mom. Never mind the actual insulin injections that we, as non-medically trained people, family members, must administer multiple times a day that can be fatal if ever incorrectly dosed. But sadly, no one ever prepared me for those other complications that would ultimately fuel this work and my presence here today. Some of those complications, no one mentioned to my family personally when we were in the hospital. And these complications, no Google article ever described when Kinsley was diagnosed just 3 years ago. No, those are typically listed as like diabetic ketoacidosis on a death certificate, but are the ultimate unjust complication that a person of diabetes will experience if they simply just cannot afford their insulin, which literally costs 10 to 15 times more here in America than in other countries like Canada, as Quinn was saying. These complications all surround access to affordable insulin. Our family personally can afford Kinsley's insulin right now, but having insurance tied to an employer is really frightful for a mom when we know that any sustainable change in my husband's employment situation could cause a really serious situation in our family and ultimately Kinsley's supply. And so that really frightens us. And ultimately, we know that at the age of 26, Kinsley will, she will age off of our policy, and then she will be in Alec's situation. And sadly, we know that with Alec, he unfortunately passed away just 1 month after he aged off Nicole's policy. So that's why I am so adamant that the Alec Smith Emergency Insulin Act is passed in Minnesota. As both Quinn and Nicole mentioned, both, there's these, the manufacturing companies continue to comment on these programs that exist, and I hear this a lot from state legislators, just go check these out. And so just a couple of weeks ago, I personally called the manufacturing company that, that we use personally, and I spent a lot of time on the phone with them. We filled out some paperwork, and we were rejected personally because our pharmacy benefit manager would not allow us, kind of similar to what Quinn was mentioning. If we use this particular program, then our pharmacy benefit manager would not allow us to use their benefits as well. So in essence, we would be paying more out of pocket. So it's really frustrating when I hear a lot of legislators in particular continue to just say, just use these programs, because it's just a fallacy. And I also heard just yesterday, I think somebody suggested or stated that we just have found out over 40% of people are being rejected. So I homeschool my kids now, but I'm a licensed teacher in the state of Minnesota, and I've spent over 10 years in Minnesota classrooms. I love teaching, and as a teacher, I would give these manufacturing companies an F, failing grade, right? That's not cool. But anyway, also, I haven't heard this today, but these insulin companies have carte blanche as it relates to, increasing these prices. If we look at the past history of price increases in the last 20 years, they have done so over 1,200% in the last 20 years. And so we just don't see those type of increases with other pharmaceuticals, right? Just let's take into consideration immunizations, for instance. Some of them you can actually get for free, right? Also, think of penicillin as another example. That was actually invented in 1928. And if we had those same type of increases with penicillin, we'd have serious pandemics on our hand. We'd have everybody and their mother, like at the Capitol right now, demanding that we have some type of price controls in place. But everybody on the political spectrum would be here today. But anyway, getting back to my experience in the classroom, as I close, I know right now all the teachers are preparing to get back into the classroom, and there are a lot of kindergarten teachers that are excited to start talking about community helpers, right? Because those kindergartners need to start learning about who you can trust in the world. And a lot of times you're teaching kids to trust doctors and firefighters and first responders, etc. But for my daughter, Kinsley, who's 8 years old, who she needs to learn to trust with the inception of the Alec Smith Emergency Insulin Act, hopefully would be pharmacists. That's who she will also need to learn to trust, because there may be a day, maybe after I'm gone, maybe after there's some type of emergency situation, she's on a field trip or whatever, I don't know. But the goal would be for her and all children with type 1 diabetes to just feel comfortable knowing that they have support. Because you know what? In this world, when you have a disease like type 1 diabetes, you need people to have your back. You are high or you are low, you have a fanny pack literally with equipment attached to your body. You have just an incredible amount of things that you have to have at your disposal at all times. And it is my hope that once this bill passes, that all children who have type 1 diabetes, including my daughter, can go to a pharmacist. And so, like everybody says here, as a mother, I just am begging you to just, let's just have some compassion for these people with diabetes. They have enough to worry about 24 hours a day, 7 days a week, to just simply live. Literally, it is a constant Russian roulette just to live. And so just to know that in the event of emergent situation, you have a place to go, a pharmacy where you will have a compassionate person provide you what you need to live is all I ask for. And for my child and all children with diabetes to know that you can go to a pharmacist is what I ask for. Thank you.
Thank you. Michelle.
Hi. I was going in order. I'm Michelle Camela. I'm type 1 diabetic. I'm from Fergus Falls, Minnesota. So me and my husband traveled this morning down here. I'm here fighting for my life. Can you pass those clinics? Because I think I'm going to need some. Out of the blue, about a year ago, I ended up just terribly sick. Couldn't walk hardly, my muscles went, couldn't think, couldn't eat, couldn't do different stuff, started losing weight, and was diagnosed a year ago with type 1 diabetes, which was a shock personally and financially, because we went from struggling 1 month to how are we going to afford $600 to $1,000 worth of supplies the next month. I was not able to work any longer. Actually, I'm a domestic violence. I was a domestic violence advocate for 20 years. I was down here all the time and trying to change laws, and now I'm down here again. Want to let everyone know that hopefully I apologize ahead of time. This is what I have to have with me at all times. This is my bewitching hours, what I call it, from 10:30 to 12, where I could drop very low, so I might have to pull it out and check my fingers, so I apologize for that. So to get back to it, I'm on disability because of it. I had to wait 3 years for that. Luckily, I got Medicare, and I'm also on Humana here in this state. And after working since I was 12 years old, I am in the loop. I can't have any discount cards. Thinking that Medicare was going to cover. Medicare does not cover what everyone thinks they do, or Humana. I have here, if anyone, pardon my notes, but I'm on the phone all the time too, trying to save my life, where I had my endocrinologist, who is a specialist of diabetes, prescribed for me a continuous glucose monitor, and I was denied and was told under Medicare rules, your request is not medically necessary. So that tells me that my life is nothing. And that's just one, so now I have this is, which I don't feel that is very reliable, so I have to do that and prick my finger and do this and try to figure out what my blood sugar is. Well, of course, I want to check it 500 times a day because it's about saving my life. So we struggled paying for my insulin. Luckily, had some friends helping us and selling off all our life treasures, basically, to afford my disease, and which is not right. I'm being extorted against. This is what it is. I'm old school. In the old days, it was mafia that was put into prison for this kind of stuff. And now, because I was denied my glucose monitor, my husband goes to 2 jobs every day wondering if he's going to come home and find me. And if I could get this glucose monitor also, it would alarm me before I got so low. And it would alarm him at work and say, there's trouble, before there's trouble. I also was denied a glucagon shot, which is a life-saving shot. So if my friends or my family come and I am in a diabetic coma, it is to save my life, and it was denied. It will 100% save my life. I don't want to get on a jag here, but heroin addicts are given Narcan for free. They are given needles for free. Why do we have to fight for this? Type 1 diabetes, I had no choice over. Type 2, yes. To a point, it's self-inflicted. I did nothing to get type 1. My brother became type 1 when he, in the late 70s, which was very unheard of in those days, and he was on the human insulin. So I got it in my head that the cheap stuff from Walmart, that, well, I can save all that money and have $25 a vial. Well, I've been on it now for 6 months and continue to go backwards. That's why I need the glucose, the continuous glucose monitor, also because it's very dangerous. The side effects of that are, it affects my mind, it affects my muscles. I run low all the time. I was at my endocrinologist a month ago, and I know people would pay a lot of money to hear this, but my A1C is too low, way too low. Then it's dangerously low because I'm on this human insulin is what they refer to it as. I have no choice. Like I spoke earlier, and this is hard because I'm old school too, but I think you need to hear this, we spent our grocery money to get here today because this is how important it is. And we will be fine. We stockpile. I, don't need sympathy or whatever, but this is how important this really is, and that everyone needs to know that. Why should I have to go? I mean, I was born and raised in Minnesota. I should not have to go to a foreign country to buy my medicine. I don't know what's in it. Yes, it's okay, probably, but still, we have to know what we're putting in our bodies because within hours, we can be gone. I just wanted to end with a story that happened to me a week ago. I check my blood sugar before I go to bed. I eat healthy. I don't eat any sugar. I'm on it all day long because I'm home all day long and I'm able to be on it. But woke up at 12 o'clock to something woke me up. I was shaking so bad, and I really believed that I was going into seizures because I was so low. I got up, I walked into the kitchen, and I had to shake my head 10 or 20 times just to get back into reality because it affects your minds when you go low. And luckily, I had enough about me that I could go over to my glucose monitor and check my blood sugar, and it was 30, which I should have been gone. And by the grace of God, I wasn't, and immediately took some orange juice and sat on the couch for an hour. But every day I start my day, I'm a very positive person, I'm a very spiritual person, so I try not to focus on it a whole lot. But you have to, for a minute, every day wake up and think, is this my day? Is this my day? And so I just appreciate all your support, and that, I'm proud to be from Minnesota, that we're gonna do this, and hopefully something can be done. But I noticed just one thing else I wanted to say is I noticed in here the emergency insulin bill that I can't be enrolled in Medicare, so that's just one more program that I don't qualify for. And also, even if I could afford it on the Medicare, there's that donut hole. And I would, with the price of my insulin, I would hit that donut hole within 2 or 3 months out of the beginning of the year, and then I would have to pay full price for all of my insulin. So I know that you have my best interest in heart, and that you will help me live longer.
And just, I know you were going to mention as part of your story, her insurance forced her off of the analog insulin, so the best insulins on the market like Novolog and Humalog, correct?
Yes.
And so
That's what my prescriptions were.
correct, that's what her endocrinologist wanted her to be on. And so they forced her to be on the Walmart, right, what you kind of hear is the Walmart insulin.
It's not an option.
Even though she's been having these terrible reactions, and even though she's having these terrible reactions multiple times a week, they are forcing her to stay on this. So I just.
It's almost daily. And I just wanted one more, I know I said one more thing before, but with that glucose monitor too that I was denied that Humana says I don't need. So since I do not have that, since I'm home alone during the day, and of course I have a telephone, if I start running low, because it takes anywhere from 45 minutes to an hour to kick in. So when I start running high or low or whatever and just feel nervous, I go out to my driveway so that if I pass out, that someone beside will come along and find me. Because I can't call the ambulance every day. I can't afford to do that. So I just hope that we can get this. We can't wait any longer. I can't wait any longer.
Thank you so much for sharing your story and for giving specific feedback on the bill, too. I think that that's partly why we're here today, is to get feedback to inform our work going forward. And the choices that you mentioned, those are choices that no one should ever face. And I just thank you for traveling and sharing that story with us and having that inform our work. And I just want to thank all of our advocates that have joined us today. And I've kind of been wrestling with this phrase, diabetes advocates, because it just feels so insufficient. You're champions, you are change makers, and if this legislative body had a tenth of the courage that our advocates have, we would have passed this bill yesterday. And I'm just so grateful. With that, what I'd like to move to is a discussion where members that are here can make comments or ask questions, and same with the advocates, champions. Raise your hand if you have questions for lawmakers or for each other, and have the opportunity to have a discussion before we close with some public testimony. Representative Winkler.
Thank you to all of you for being such fighters for this issue. As I mentioned, I have a son with type 1 diabetes, and we talked a lot about insulin today, but of course, and we made reference to other things, but that's just one part of the financial cost, from pumps and continuous glucose monitors, test strips. My son this week is at Camp Needlepoint on the St. Croix, and yours, yeah. So, but not these things. You can get terrific care, and the technology that is underway, funded through lots of research, is very promising, but it's very expensive, and it's not available to a lot of people. My son has never used an insulin pen ever. He's been on a pump since he was 18 months old. We never had to deal with that. And it's part of the overall inequity in the whole healthcare system. It isn't just insulin and diabetes, it is the whole system. So I have 3 sons. The middle son has type 1. My eldest has a peanut allergy, and EpiPens are another example of pharmaceutical greed leading to life-saving implements being unaffordable to people and resulting in death. In fact, my 3 sons play a game where they called Who Has It Worse? And my youngest only can claim that he's the youngest child, and that makes it the worst for him. And they joke about it, but these are things that you see in daily life. And as a policymaker, for all of us, we may be personally affected by one disease or one issue or another, but it's our job to look at the broader whole. And I want to come back to the funding point about this bill, because we could, through general fund, provide, or through the Healthcare Access Fund, we could provide emergency insulin for everybody, and all the taxpayers would participate in that. But there is a broader principle and a broader battle going on with the pharmaceutical industry that needs to be fought. We did that in part this year with the opioid bill, in which we insisted that a greedy industry that had killed people be part of the solution to pay for the fix. Part of the battle on this insulin bill is not bickering between parties. It is a principle that those who have benefited from their actions, which are immoral and unethical, should be part of paying for the solution. It's an important principle. And the pharmaceutical industry is eyeing Minnesota because we are starting to establish a principle that they actually have to pay up, and they don't like it very much. So as much as insulin is vital to diabetics and it's part of a broader diabetic affordability issue, there is, I think anybody in this room who is a diabetes advocate would acknowledge there are many diseases whose treatments are unaffordable, and we have to not just worry about the ones that affect us or affect our children. And so there is a broader fight here, and if Minnesota can be a state that makes the pharmaceutical industry come to heel and be part of the solution, we will be doing something for healthcare around the country, and that's in part why this is such a big fight. I think Senator Abler, however, makes a very good point, which is that we should not be holding diabetics hostage forever while we have this fight. We can solve this problem and continue to fight it as the months go on. So I would hope that certainly the House of Representatives is ready to pass a bill again tomorrow if the governor would call a special session, but we need the cooperation of the Senate leadership in order to do that. And that is the only thing in my mind that is standing in the way of passing a bill along the lines that you described, Senator, tomorrow.
Representative Cantrell.
Thank you, Representative Howard, and thank you so much to all the advocates for being so brave and for sharing your stories here today. Ms. Smith-Holt, I remember first reading about Alec's passing, and I thought to myself, how is this possible in Minnesota in this day and age that a 26-year-old dies from not being able to access insulin, a drug that's been around for nearly a century, a drug that all of these companies have recouped their R&D costs on already. And we have a young man, because he turned 26, no longer is able to be here with us. I thought that was absolutely appalling. Personally, when I was 21 years old, because I was on my parents' health insurance, I was able to afford 6 months of cancer treatment for Hodgkin's lymphoma that ultimately would have cost me $500,000. The only reason why I'm here right now in the Minnesota House of Representatives is because I was not 26 years old when I got diagnosed with cancer. And I stand with all of you in saying that we need to end the price gouging, we need to end the price manipulation and the patient abuse, quite frankly, inflicted upon Minnesotans by the pharmaceutical industry, by the pharmacy benefit managers, by these people who don't care at all about patients, who simply want to reap a profit off these drugs that, frankly, many of them didn't even have a hand in creating. So moving forward, I don't think that this should be, and it should have never been, a partisan issue. And I stand ready with all of you to fight to make sure that we don't lose any more lives because people aren't able to access their insulin, access their chemotherapy drugs, access any type of medication, because healthcare is a human right. To be here without obstacles put in place financially by companies who want to generate a profit, being here is a human right. So we need to put an end to the greed in our healthcare system, and we need to make sure that this does not continue to happen, because we pay twice as much in the United States for healthcare, and we have worse outcomes than Canada. So thank you so much for your courage. I am so sorry that this is the reality right now, but we're determined to make sure that that changes moving forward. So thank you.
Representative Mason.
Thank you, Mr. Chair. Many of us have been here for, well, since at least last December, and probably many of us before that as well, listening to these stories and to the experiences, knowing we live in one of the richest countries in the world. And so the fact that we, in the House at least, we passed the bill, but knowing it didn't get to the governor is incredibly disheartening. And I'm sure most of the legislators here are getting emails and comments from their constituents asking and expecting us to come up with a solution. I mean, to know that people are dying because we can't come up with something is just wrong. And one of the things, having served as an elected official, there are many times where what's legal to me is not moral. And certainly what's happening right now is just plain wrong. To know that companies and people are making substantial profits by denying life-saving medications is plain wrong. It's unethical. And maybe, if nothing else, we should be attacking from different ways of making sure that these people that are in positions to do something that is so, it's more than wrong. As I said, it's unethical, it's immoral. So my thought is, and I'll say this, it's to a point now where it's more than a matter of a difference of opinion. What's going on is unethical. We need to be doing something, and we need to use our resources to get the people that are not going to vote the right way to vote and do it as soon as possible. I think we have the resources. There is enough people that have been coming here again and again. We need to get it done.
Thank you. Representative Bonner.
Thank you, Mr. Chair. My great-grandmother grew up in a time when she had diabetes, and we had to boil syringes, right, in order for her to stay alive. And I remember my sister when she was diagnosed at age 3, and I don't know if my mother, who's sitting behind me, by the way, even remembers this, but I do remember at one time a discussion about whether they had done something to cause my sister to have diabetes. Was it their fault that she was diagnosed at age 3? It wasn't her fault. It's what happens. And I can tell you that growing up with a sister with diabetes is a heavy burden for the entire family. Constantly thinking about blood sugars, when those snacks need to be administered, making sure that we eat on a regular schedule, watching activity levels. And at least once a summer, when my sister would be outside playing or doing things outside like normal kids do, her blood sugar would drop and she would have an insulin reaction. And for folks around, and many of you in this room understand what that's like, but for those who don't, it is terrifying. It is truly terrifying to witness. And I can only begin to imagine, and there are many times I sat and I thought about what it must be like to be my sister, to be locked inside that insulin reaction, to be powerless, to be dependent on the people around you to administer the one thing you need to breathe, insulin. Without that insulin, you cannot breathe. That is how this works. This is not optional. People don't abuse insulin. We don't need to set artificial limits on access to insulin. No one abuses insulin. They must have it to breathe, to live. It is a necessary part. And I can tell you that personally, when I went off to college, for the first few months, I had a really tough time. I missed my family, yes, but I will tell you there was a huge sense of guilt when I left. And I want to tell you why. Because I shared a room with my sister, and if my sister had an insulin reaction in the middle of the night, I was the one who raised the alarm. I was the one who called my mother to administer that insulin shot. I was the one who sat with my sister and consoled her and comforted her and tried to make her feel comfortable until we could get her that life-saving insulin. And I was terrified when I went to college. What would happen if my sister had an insulin reaction in the middle of the night and I wasn't there? I have to tell you that my sister continued to struggle with this disease on how to get health insurance when she aged out of my parents and when she got married. It was a challenge. Getting access to anything has been a challenge. This is not something we need to debate and continue to debate. This is about making sure that people have access to life-saving drugs. We have all too long let healthcare companies, pharmaceutical companies, and pharmacy benefit managers take the care out of healthcare. It is time that we manage that, and we put patients back in the driver's seat where they belong. And it is my hope today that we can use this information and these hearings and this testimony to remember that when we have all these stories, what we're talking about here is giving people dignity and respect. And that is the thing that is all too often missing from these discussions. Again, I just want to repeat, insulin is like breathing. We can't do without it. I want to thank everyone here for being here today. And I want to say to those folks in this room who we have not gotten this done yet, that I apologize that we have failed you. We will continue to do better, and we will get it done. Thank you.
Representative Bierman.
Thank you, Representative Howard. Thank you for all the people that came out today and participated, and all the many stories that some of which are new and some of which we've heard far too many times. I just wanted to mention or ask about the fact that, you know, this is not a partisan issue at all, as we all know. And I'm hoping that as your committee, which I thank you for forming this summer, it was very disheartening, as Rep. Bonner mentioned, at how it ended last year. This was just something that should have been done as an interim stopgap before we really continue to work on solutions that affect all of us in Minnesota, all of us in the country, and that's the high price of pharmaceuticals of all types. But insulin is something that we should just do. People understand it, people know the stories, people are living with it, and somehow trying to survive against great odds, as we've heard today. So I just want to mention, as I was door knocking a couple nights ago, I went to many doors. Pharmaceuticals came up at many of those doors, and it doesn't matter what party you're with. Everybody's affected by this issue, and I just hope we can use this issue, the price of insulin, as a starting point on this, get this done for the state of Minnesota, and be a model for the nation on it. And as Representative Majority Leader Winkler said, this is, you know, one part of it, but we should get it done. And I'm hoping as your committee moves forward that you do not shy away from holding pharmaceutical companies accountable and make them come to the table and make sure that we can move forward on it as soon as possible. Thanks.
Thank you. And I did want to mention, we're holding this hearing today. We're also, House Representatives, or the House DFL caucus and members are holding a series of listening sessions over the coming months on this very topic to continue to engage with the public. And I know that Representative Liebling, who wanted to be here today, had surgery, so she's following at home. I know that Representative Liebling is planning on holding an official HHS finance hearing in the coming months as well. We do have folks that have signed up to testify, and so I think we'll have folks Senator Pratt. Let me turn it over to Senator Pratt first.
Thank you, and only because I have a hard stop here at noon, I wanted to just say a couple of things. Having been part of the, look, I got involved in this issue really on the night of special session. I know we had something going into the conference committee. I was surprised as anyone that it came out of conference committee with no solution. I was really, I mean, and when the House and the Senate essentially take the same vote, the only difference being how the thing is funded. And trying to put together a bill this complex as a floor amendment, that's not how good legislation is done. That's not how you build working relationships. Now, there's been a lot of criticism about how the budgets came together. And I've been one of the critics of how it all came together. This was not a smooth landing session. And there were a lot of issues, and this probably being one of the most important issues that didn't get addressed. and I'm heartened to hear so much of this being, this shouldn't be a partisan issue, right? This shouldn't be politics. And yet, I think one of the biggest obstacles that we've had is that it has been a weaponized issue. It has been used. In fact, I just got a friend of mine just sent me a letter that they got from the governor's campaign. He's raising money on this very issue. That's not how we work together. I think I might have a slight disagreement with Representative Howard in that I think I have some additional concerns beyond just how this is funded that we needed to work on a little bit more. You know, what is the objectives? Is this short term? Is this meant to be permanent? How do we get this thing stood up more quickly than I think what the current proposal says? I mean, I want to get this thing up and running January 1 or sooner. And if I, you know, just if I think about the key objective, then the other stuff kind of falls into place. And so I would say, you know, to the advocates, hold my caucus, hold the Senate Republicans accountable to get something done. But hold the other side accountable too. Because even today, I've heard some politicking that I think just is getting in the way of this thing. Let's just get it done. And if we have to go, Representative Howard, if we have to go off and we have to work on this a little bit more, let's work on it a little bit more. But, you know, if we can get this thing stood up and running, and let's even take a partial solution, just so the darn thing gets up and running and people can get the insulin they need, right? Let's focus on the lives. Let's focus on the health. And thank you for sharing your story, because I wasn't aware that you were having those same problems. In fact, I've heard just the opposite. And I never know that unless you come and tell me. So, you know, let's put down the sabers. And let's continue the discussions. And I want to thank everybody for telling your stories. I don't have a diabetic story. I just know that I'm here to make sure that and I'm engaged because, you know, like Senator Abler, nobody else should die because of this. I guess that's all I really had to say. Thank you.
Thanks, Senator. And just a quick response. I think everybody here wants to get this up and running as fast as we can. That's why we're here. That's why we're doing this work out in public. I mean, I really do think that part of the end of the legislative session, when we would go behind closed doors and don't do this important work out in public, that is an impediment. I would say an impediment is, and there's no way to, I agree we should put our sabers down, but the reality is the Senate Republican leadership and HHS chair just yesterday evaded taking any action on this issue. I believe the Chair Benson mentioned when there's something to react to, you know, we'll hold a hearing. Well, there is something to react to. It's the Alec Smith Emergency Insulin Act. And if we're going to get this bill up and running, we need everyone to step up. I think that on a bipartisan basis, there are legislators willing to step up and do good work, and folks are around this table. That's vitally important. But it's going to take everybody. It's going to take everybody. And right now, there's some important people that have the ability to help us move this forward that are not stepping up. And that's just a reality that's facing us. And that's why something like this is important, to be out in public, to continue pushing, to continue centering the Minnesotans whose lives are at stake. That's why we're holding more listening sessions. The more we do this work in public, the more that Minnesotans will push us as leaders to do what we need to do to get this done. Representative Cleveland.
Just
Yep.
in response to
Sure.
that, you know, let me just say I think that's somewhat of an unfair characterization. I've talked to Senator Benson. She's interested in this issue. Compromise means that both sides move a little bit. And we've got to continue to work on finding that middle ground, because quite honestly, as I looked at the framework coming out of the bipartisan committee, I don't know that we're at that middle ground yet, which is why I think we broke that process up a little bit too early. And I guess it's things like that where we start throwing accusations at individuals and at chambers that, for me, makes me think I might not want to be here and I might not want to hear these stories, right? I want to get a solution done. And you know, I can tell you, I've talked to both Senator Gazelka and Senator Benson, and they are interested in this solution, but they need to make sure that it's a solution that works, that's affordable, that can be implemented, that can be effective, and let's continue to work on finding that middle ground. But that, you know, if it's this and the Senate has to do what the House wants, then that's not compromise. That's not coming together. That's not working bipartisan. One of our colleagues, and I won't say who it was, they're not here today, said they weren't interested in getting a preponderance of either body to vote for this bill. They just wanted enough votes to get it passed. That's not compromise. That's not bipartisanship. I'm interested in true bipartisanship. I'm interested in true compromise. I think Senator Abler, from our discussions, is extremely interested in that. So, you know, and again, I'm sorry I have to take off early, but, and I'm sure Representative Howard, you probably disagree with me, and I respect that, but, you know, that's if we really want to get something done, there's got to be movement from the House and the Senate. It can't just be requiring the Senate to move. It just can't be saying, take it or leave it. And sometimes I feel like that's where we're at.
I respect your point of view, Senator Pratt. I just want to say one more comment before you go. If you have been having conversations with Senator Gazelka and Senator Benson, I'd ask you to pass along a message, and that we are ready to meet, to work, to find that compromise. But you can't compromise with someone who refuses to engage whatsoever on the issue. So I just ask you to pass along that message.
Representative Howard.
Representative Howard.
Thank you, Representative Howard. I feel strongly that I need to respond as well. Having worked on this issue starting at the beginning of the last legislative session, not at the beginning of special session, where this process falls apart is when we don't engage the public. When legislators refuse to meet with advocates in their district, the process falls apart. When legislators who are chairs of powerful committees refuse to hold hearings and hear a bill that the public is asking to have input on, that is where the process falls apart. You are absolutely right. This is not a Democrat and Republican issue. This is an issue about the people of Minnesota. And the people of Minnesota make this process run. And that's why I am so glad that we are having this conversation out in the open. Do Democrats and Republicans need to come together? Yes. Has there been significant conversations and movement among many of us behind the scenes? Yes. That work is happening. But it doesn't get to happen, to me, a compromise and a deal does not exist until the folks in this room and the folks around the state have their say with their legislators, have their moment in front of a committee. That's when this process works. So keep it in the public. Keep coming to the table. That is what we need.
Senator Abler, and we do have folks to testify as well.
So I'll just be brief. Actually, for the people watching, this is actually a real discussion, and it's healthy. And sometimes real discussions are kind of messy. I want to say I agree with all the three last speakers. I agree with Senator Pratt and Representative Halverson and Representative Howard, and you're all correct. I'm going to keep looking forward to a solution that works. Just have to go back to one of my comments I made. I would be happy to have pharma pay. It is a solution that does not work. It will be sued and tied up forever, and nobody will get anything done, and people will die. That's why I'm moving away from that in my preferred way compared to a real way. So I just want to make sure people understand I wasn't trying to be wimpy about that. I'm just trying to be real. I want to just point out the ray of hope. Representative Winkler left already, but when he commented that the direction that the final thing would come in would be kind of the way that I was talking with this shared thing, I think he used the word part of. And I think absolutely a farmer should be part of it. But I want to remind, I mean, here we are, there's all these people here. I don't see a farmer at the table offering us a deal. You know who they're going to offer a deal? Actually, when Representative Winkler and Representative Portman sit down with Speaker Gazelka and the governor, they'll then be talking about what they're going to be doing, because they're realizing that those are the people with the levers that are very powerful. And that's why I'm at my point now. But this is a really healthy discussion. And I want to thank everybody for being candid, because when you're candid, you actually can get to a resolution. When you're doing a dance like we care, we don't care. I mean, staying on a position that's not tenable doesn't get us to a resolution. So both sides are showing, I think, willingness. Hopefully I'm an exemplar of whatever my people are. I'm kind of a divergent version of my people, but this is really important. And everyone who testified, I mean, you got to weep. So I'll stop. Thank you, Mr. Chair.
Representative Cleaborn.
Thank you, Mr. Chair. So I represent Plymouth, and Plymouth is a pretty affluent community. There is not one door that I go to where health care is not discussed. At 48, you are very likely to lose your job and lose your health insurance because you become expensive and they can replace you with someone younger. So it's not just a matter of turning 26, it's a matter of turning 28, it's a matter of who were you fortunate enough to have an insurance company policy with. I ran for office because my individual insurance policy was $1,500 a month for my husband and I, and the premiums would drop when we did reinsurance, but then our deductibles would double. So $1,500 a month, $14,000 in deductible. I'm asthmatic, so asthma medicine that cost me $20 40 years ago is now $300 a month. For one inhaler, I need two. I can't use the preferred medicine I want because it's not covered on my formulary. When I ran for office, my health insurance dropped. When I was elected, my health insurance premium dropped to $221 a month for my family coverage. Imagine that. I had to give up my higher paying employment as a mediator with working in conflict and trying to find these solutions so that I could have affordable health insurance. That not everybody can knock 56,000 doors and make that happen. I'll say that. Our budgets, our moral documents, it's who are we as Minnesotans? What do we want? Whenever we look at a compromise of any sort, it's who pays, who benefits. That's how it works. We have to honestly step back from Republican, Democrat, Independent, Cannabis, whatever party you want to name yourself as, and say, what's the real driver behind my decision and my vote? What is making me take the vote that I'm taking as a legislator? We cannot have people in our state dying because they don't have access to the affordable medication that they need. I don't want to derail the insulin bill because asthmatics don't have medicine. This bill is a start of who we are and what our values are, but it is certainly no end to the conversation. Already today in the testimony, we've heard how one person will be left out when this person is an advocate for the work that's being done at the table. I honor your work, Senator Abler, for coming to the table and having these discussions and saying it's not about the Senate or the House. The House did pass this bill. That's a fact. The public record is there, it says that. I want us to remember that we are not talking just about bills. We're talking about lives. We're talking about our children. We're talking about our future. We're talking about our families. And this has to be a value statement as to who we are as Minnesotans. And everyone is asking us to fix this. That's what I'm saying.
Senator Wickland, and then I'm going to be cognizant of time. After Senator Wickland, we're going to have some public testimony.
Thank you. I just wanted to make a brief comment, and it's unfortunate Senator Pratt had to leave early, but I just wanted to reiterate that there are at least 4 of us on the HHS committee, Republican and Democrats, who are ready to continue discussions and to have hearings so that we can really get at some of these details that he or others have concerns about. And I know there are many other members of that committee who would be happy to have those discussions as well. We need more input to make it even better than it is, and that should happen, I believe it should happen to the public. So I hope that we can make that happen soon.
Thank you. And then I might have us take like a minute or 2 breaks so people can reposition, because I think with this room, the best place for folks to deliver public testimony is right up front.
And it might be good to have
That's
just
right, we
a
can-
bathroom break.
Oh, they're gonna sit there. Oh.
Actually, yeah. Yes. It's actually like.
And then, so we have a list, and so as folks reposition, and we'll go till 12:30 here, and we have 4 people on the list to testify. The first person I want to invite up is Ian St. James.
Then you don't have to leave, and then, I forgot to bring you to the doctor class. Sure. So, yeah, 4 boxes for you. Do you think I'll see that? Gotcha. Okay. That's terrible.
Thank you for joining us.
Thank you. You're welcome.
Yeah, we're ready to start. Yes, please do.
First of all, I will try and speak as clearly as possible. I've been going through 2 cancers. One was in my mouth. I had a lot of dental surgery, so I'll try and be as clear as I can and not whistle. Thanks. I didn't even know I was going to be here today. Didn't expect to speak until I got in the room and I heard all of you speaking. And while you've been speaking, I've been taking notes, and it led to what I'm going to have to say to you or ask you. Again, I said I didn't know I was coming, but I dreamed of Jesse all last night. And then his mom called me this morning to tell me about this and ask if I would come along. Of course, here I am. Jesse was just 21 years old when he died 47 days ago. He died from insulin ration. Some of you may know his story, some may not. I will always be glad to speak to him. Oh, by the way, this is him. I happen to be unfortunate enough to have his mom as my friend. Her and I lived together, and I was fortunate enough to help deliver him and raise him the first 5 years of his life. 5 years later, he was working in my garden. He had come over, and his mom was saying how he had been kind of sick, and I looked at him, and he was very thin, and in the few hours he was working, he went through 9 bottles of water. And I said, he needs to get checked in, and literally it was like the next day or something, and sure enough, he has type 1 diabetes. I'm going to now bounce around. I have been affected by type 1 diabetes my entire life. My father was a type 1 diabetic. At the time, it was called juvenile diabetes. And he was one of the first people in the United States to receive insulin. So I grew up with a lot of things. I mean, we didn't have all the advances we did today. I remember finding him on the floor 6, 7 years old, and we were having to shove melted Reese's cups and orange juice and sugar in his mouth to help him. This is what I grew up with. I grew up with going down to a drugstore and hearing my brothers and sisters just running up to the department saying, I need NPH 180, I need U100. That's how readily accessible insulin was. And it should be today. It shouldn't be treated the way it is. Back to what I was writing. Jesse didn't die from insulin rationing. He died from the prohibitive cost of insulin. That's an important difference. I hear a lot of people talk about insulin rationing. That's not their cause of death. It's not the diabetes. It's not this. It needs to be put that it's the prohibitive cost and access to insulin. Access to a program like this would have saved his life. He would be here today. I have no doubt about that. The night before we delivered Jesse, I was assaulted, and we didn't know, but I contracted HIV that night. We didn't know for 2 months because 20 years ago, it took 2 months to get your results. And as we lived and we grew together, when Jesse was little, a term was given for Cindy and Jesse when I was going through all these things. They were trying to figure out how to take care of things with that and my cancers. And it was that they were HIV affected. And that's why I say I am T1D affected. I am part of the family that is affected on a daily basis. When I hear people talking about, like the woman who spoke about her sister, she is T1D affected. This affects you every day, all the time. And that's an important thing to speak to. Speaking about the hurdles of programs of patient assistance, I can tell you, I don't think they really work well, whether it's for insulin, cancer medications, HIV medications. I've been through literally hundreds of them. I can tell you the cost this has. For me and my cancer, I have eviction court on Friday again. Every time I get cancer, guess what? I can't afford things. I get evicted and I'm living in a storage facility. That's just the prohibitive costs in healthcare. But for people with insulin, this is a constant. For Cindy and her family, that day when we found Jesse, Cindy had contacted me. I was going down for my chemo session. I had to go because of the type of chemo I had to receive. I had to go down to the Mayo Clinic to get it. She had to pick me up early, and she told me Jesse had been sick. So we were going to check on him on the way back. But she had to make her mortgage payment. So we were, as I always say, you know, my favorite thing, robbing Peter to pay Paul to get all together money so that she can make her mortgage payment. And she has a family of 6. One of them is an adult child who lives outside the home. That is Jesse on her insurance program. So while we talk and nothing about it, we talk about the aging out. This isn't just people aging out. This is a family, the mother, the father, they work. They have the insurance, they have the other kids, and then they have an adult child who's on their insurance, and he's working 1 and 2 jobs, and they cannot afford the insulin. So this is spreading just in the short time since Alec's death. It's getting that much worse, and it's going to get worse. There's no time to wait. Ironically, the session comes back in the legislator on Jesse's birthday next year. And I pray no one dies. I pray that. It's called the emergency insulin bill on this sheet because people need it in an emergency. But to me, that's not what it is. It's an emergency that you pass the damn thing now. You call special session and you get the damn thing passed. That's the emergency. Sorry. I'm trying not to get too opinionated and be as fact-based on everything all of you said, and I respect and thank you all for this. I've heard insulin today multiple times referred to as a life-saving medication, and I don't believe that's true. It's a life-necessary drug. It's not life-saving. Life-saving is jumping in the lake and helping someone who's drowning. These people need this. As a person who battles so many cancers, so many things, people, wow, you made it. I could care less. I look at these people. I look at someone like Jesse. I think when I had to walk in there and find his body, and that he was dead, and the paramedics were like, no, you still got to try and resuscitate him. I live with that every night because someone somewhere is living high on the hog off this medicine that as a little boy I watched we could walk right in and get to help my father. So that's about all I can speak to at this point, but it is very important that we don't hold out. There's no waiting. There is no waiting for partisan bickering. This affects people everywhere, every race, every religion, everything. I don't care. I know so many people of everything. But we can't sit there and argue about who's going to do what. It just needs to be done, and it needs to be done now. I'm sorry. Thank you.
Thank you so much. And I just want to say how sorry I am. I know we all are for your loss and for your grief. I know that if there's anything we could do to take it away, we would. But what we can do is think about Jesse every single day until we pass this bill. Thank you.
Yeah, I really don't want anyone to go through this. I'm not his blood family, but there's nothing worse than my having to turn around to his mom to try and shield her from seeing what she saw. Her child dead on the floor. No one should have to see that. So thank you for what you're doing.
Thank you. We have 10 minutes of time allotted, but I want, hopefully everyone wouldn't mind going a little over to hear from folks. If our testifiers that come up if they could keep to about 2 minutes, so that we can hear from everybody. And next, Nathan Lowy.
Hello, thank you.
Thank you.
My name is Nathan Lowy. I'm a resident in District 18. I am a type 1 diabetic and have been for over 29 years. My son is also a type 1 diabetic and was diagnosed at the age of 6, and he will be 9 in a few weeks. We all know what the costs are of insulin, $340 a vial. My personal costs per month for just the insulin based on retail prices are more than my mortgage, my car payment, and my major utilities combined. Times that by 2 because I have a diabetic son. Having a bill where we don't have to worry about whether we're going to be able to afford the insulin today, tomorrow, next month is crucial. 110% crucial. We have a family friend who also has a diabetic son who is 17 years old. He told me personally, he is afraid to grow up. He is afraid to grow up. And that is because of the cost of insulin. We don't know, Yes, you may have insurance until you're 26, but that $340 a vial, even if you have insurance, my copays for my insulin alone, $700+ a month, or $700+ per 3 months. My son's $900 per 3 months. So whether you have the $340 a vial cost that you have to pay, or you're paying a copay, which, don't get me wrong, the copay is still significantly less than the $8,000 that we'd have to pay every 3 months shelf price. But $1,600 every 3 months is still absolutely ridiculous. And if you look at somebody who is 18 or 26, who is just getting out of high school or just getting out of college, how does somebody have a job at that point that can afford that amount of money? Especially when you're looking at it being more than a married father of 3, mortgage, car payment, and major utilities. We need this passed, and yesterday isn't an option, but we needed it passed yesterday.
Thank you.
Thank you.
Next up is Rob Kilborn, and on deck, we have Natalie Iden, Michelle Schindler, and Diane Freeman.
Hello, my name is Rob Kilborn. I'm a college professor. I teach psychology, and one of my greatest interests is teaching statistics. I want to be clear to you the sense of urgency that's occurred, not just since we started this in December, but just in the last few months. So I wanted to share with you some impact numbers to make sure you understand what's going on here. First of all, Minnesota has 450,000 people with diabetes. So we're looking at type 1s and type 2s, and that name hasn't, type 2s haven't been talked about, but they use insulin as well. And they're in similar situations, so I think that's really important. Numbers that I think that we all have held on to is this 25% of people rationing. I can assure you, as someone who plays with statistics and teaches psychology in this world, that that number is low for underreporting because the stigma associated, just the sadness. In fact, I stood in front of you today having rationed my type 2 medication all summer. I just started taking it again yesterday because it's $1,400 a month. But furthermore, for this room, and why we should be terrified that there are going to be more Alex and Jesse's, is that data that came out June 14th of this year, so 6 weeks ago, showed that people from 18 to 25, that the number who ration their insulin is actually 43%. So we're looking at almost half. And again, I can assure you that's a low number because of the stigma associated and people not being willing. So if we're not doing something about this quickly, we're going to have a whole lot more Alex and Jesse. So I just implore you to use these talking points to get this through. Thank you.
Thank you. And next up, if Ms. Iden, Schindler, and Freeman could testify together. Are you here to? Sure. Okay, that'd be great. Thank you.
Hi, I'm Natalie Iden. Sorry, it's a big chair. I'm here to speak a little bit different topic, but it definitely relates. I have a life-threatening terminal illness, stage 4 cancer. I've had it for 14 years. I've paid my maximum out of pocket every January 15th, maybe the 10th, sometimes the 1st. I need these drugs to live. If I don't have these drugs, I'm dead. My drugs today cost $28,654. Excuse me, the drug pricing that the hospital charges, $28,654 every 21 days. I'm fortunate these drugs live in my body for 28 days, but I'm required to have them every 21 days. My cancer was in my breast, my bone, my liver, and my lung. Today it's stable. These are life-saving drugs. I need to have them. It puts everyone involved in anybody who I know knows our financial toxicity due to the coverage and costs of these life-saving, with my life-threatening illness, I have to have them.
Thank you.
Hi, my name is Michelle Schindler. I'm from Chaska, Minnesota. I have a 23-year-old son who is type 1 diabetic. He's survived the very ketoacidosis that took both Jesse and Alex's life. He survived twice. We're very fortunate. He will be aging off our insurance very soon, and I have the exact concern that he will ration his insulin because he cannot afford it. He'll be a college graduate in a short time. He won't be making enough money to pay out of pocket for insulin. I also am diabetic. My diabetes was caused by a side effect of cancer drugs. So the high cost of insulin is not just the only drug we should be talking about. We should be talking about the high cost of all drugs, because the cost is not just the drug itself, but the complications that ensue after the fact. It ripples through our society, and it's a challenge that we should be taking on. We took on big tobacco. I think we should take on big pharma.
Thank you.
I'm Diane, and I live in Excelsior, and I also I'm here representing metastatic breast cancer patients, and I now I'm insulin dependent. I'm on metformin, I'm on Trulicity, and I'm on a drug that costs $18,400 a month that just got approved by the FDA. Granted, I'm in remission, but I also want people to know that cancer patients, we ration our drugs, we share our drugs, we send our drugs across the country to other patients who, once you progress, your doctor says stop, move on to a next drug. Your drug might cost $15,000. Someone in California, we send our drugs around. It's what it is. I just want some statistics. 26,000 new cases of cancer will be in Minnesota just this year. 1 in 2 of us will be diagnosed with breast, prostate, lung, colon. By 2020, the cost will be $158 billion for cancer. The average cost for a cancer patient is $100,000 a year for drugs. That is not including our oral chemo drugs that we're all getting now and are insured different ways. We have shortened survival because of the toxicity. We skip doses. People are basically going bankrupt. Anyway, so all the drugs, we need to work on everything. And we're all feeling the pain of the cost of these drugs.
And come to the meeting on September 25th.
We're all
about
at the
lowering
task
drug
force
price-
meetings all the time.
Lowering drug pricing, thank you.
Thank you. Next, and our last testifiers are with Medica, Nicole White and Matt Schaefer. Sorry, excuse me. Thank you.
Thank you, Mr. Chair, members of the committee. For the record, my name is Matt Schaefer. I'm on the government relations team for Medica. As members of this committee have alluded to, we recently made some changes in how we will be covering insulin, and I'd like to introduce my colleague, Nicole White, our Senior Vice President of Health Services, to fill you in on the details.
Hello, everyone. Mr. Chair, for the record, my name is Nicole White. I lead health services at Medica. As we've so passionately heard through so many heart-wrenching stories today, the soaring cost of insulin is a very serious problem for people with diabetes who require this life-saving drug. Over 30 million Americans, over 400,000 Minnesotans are living with diabetes. And at Medica, as a leadership team, we asked ourselves, what more can we do? We wanted to do something. And we decided to invest in our communities, in our members that we serve. And through that, we have a new program that caps the price of insulin. So our members who have fully insured coverage through Medica in the group and individual business will not pay more than $25 for a 30-day supply of insulin. And we believe this investment will make a meaningful difference in decreasing the financial burden for people living with diabetes. I want to thank the Department of Commerce, they were very flexible. They helped us and allowed us to make this change to our products that were already filed for 2020. We really felt that it was very important that we acted now. And we've received a lot of feedback at Medica about this change. And for me, the most meaningful impact has come from my friends, my family members, and the members that we serve who have shared their stories about what a positive impact this is going to have in their life. And that's exactly why we did this. We wanted to invest in our communities, and we wanted to do something to help. I'll conclude by saying I know this committee has a lot of work yet to do when it comes to mitigating the cost that members pay for insulin. And I sincerely hope that you're all able to meet that objective. As a pharmacist myself, I have seen firsthand, personally, the devastating impacts that lack of affordable access to insulin has on patients with diabetes, and you have my personal support.
Thank you, and thank you to Medica for stepping up. We have seen another insurer in the last days step up as well, and we hope that others will follow. And I'd be remiss if I didn't say that we need more people to step up that are part of this solution. We need the insulin manufacturers that are profiting in huge sums of money to also be part of this solution. If everybody steps up, including the legislature, including the insulin manufacturers, our insurers, then we can create a system where we make sure that nobody falls through the cracks. And again, I just want to appreciate your testimony and for stepping up to be part of this solution.
Can
Ms.
I
Smith
ask
Holt.
the Medica group a question? The $25 insulin, are you going to have your subscribers use the Walmart insulin, or is it going to be the name brand Novolog, Humalog, Tresiba?
It's all of our covered products, which is...
And then are there plans to increase the premium cost to
No,
offset that?
This will not impact premium costs. We are investing. It's a significant investment in our community, but we feel like it's the important thing to do.
Thank you.
Thank you. Well, we're approaching the end, and I just want to thank everybody who came to participate, to testify. It was incredibly powerful. And where do we go from here? Well, where we go from here is we keep pushing and recognize that we all have an obligation to step up to make sure that no one in Minnesota loses their life because they can't afford the insulin they need to survive. We're going to be holding listening sessions, as I said. Senator Abler is right on the money. We need our leadership at every level to be part of the solution as well. And I think the public, everyone who's here, everyone who's watching, has a role in this as well. I really believe it's through the stories of Minnesotans and your pushing and advocacy that has brought us to where we are here, and it will be what gets us across the finish line. So continue to raise your voice and push us to take action. Together we can. The hope is that we can solve this. I know we can together. And again, just thank you all for being part of this today.